One of my patients said the other day, why are you talking so much about hormones and perimenopause when you're known for women's health and connective tissue disorders? Okay, so that's true. I am generally known for women's health and connective tissue disorders. But here's the thing. I'm writing this book. And when I got to the chapter with perimenopause and I started looking at the research, I was floored. I was floored by the lack of knowledge of people in pop culture. I was floored by the lack of research. I was floored by the doctors, generally speaking, lack of knowledge and how much hormones change my patients. Now, for years, I've watched women go on and off hormones, and I am telling you true story. I used to have this really lovely patient and she moved away, but I was going to work on her very arthritic neck. So each week I would hold her head, do some manual traction, work on her joints, do all these things. And there was this period of time where her hair was getting thicker and stronger. Her skin was glowing. Her joint pain was better. Her headaches were less. And I asked her, I was going to say, Sally, what's different? She started doing hormones. Now, go forward a year. I hadn't seen her. She came back. Her skin was dull. Her hair was getting thin. Her neck was so stiff. And I was talking to her and assessing her. And I said, Sally, you still taking your hormones? And she was like, oh yeah, it ran out. I totally forgot to fill it. I said, well, do you remember last time when you started taking it and it was super profound? And she said, oh yeah, I forgot. So I'm going to get that filled. Yeah. This is when I really realized that hormones make a difference with joint pain in women. So I specialize in women, inflammation, connective tissue. But when your hormones are crap, you're not optimal. And I see it in your joint pain, in your frozen shoulder and your stiff neck. And then your vagina hurts because you now have urinary incontinence and pelvic floor weakness and pain with intercourse because all these tissues need hormones. So then I thought, I'm just going to be stuck writing this perimenopause chapter because the level of infuriation that is in me that people don't know. And if people knew, could they do something different? Could they prevent some of the pain that they have? Have you ever had frozen shoulder? Have you seen people have frozen shoulder? If you could prevent frozen shoulder, wouldn't you? Wouldn't you? Now, in fairness, frozen shoulder is not just sex hormones. It is also can be a thyroid imbalance, but you get my point. I firmly believe that prevention is better than treatment. And yes, hormones are not for all. But for many people, if you are feeling not like yourself, it's something to check out.